Welcome to Clinical Capsules from TRC Healthcare, your trusted source for practical, evidence-based updates. On this episode, Associate Editor and Clinical Pharmacist Don Weinberger walks through the science behind male pattern baldness, along with available treatment options. He provides counseling points and safety tips for Finasteride, Minoxidil, Ketoconazole Shampoo, and natural supplements, plus ways to help patients set realistic expectations for hair regrowth, in an excerpt from our popular Pharmacy Essential Updates webinar series. This podcast offers continuing education credit for pharmacists and pharmacy technicians. Please log into your pharmacist letter or pharmacy technician's letter account and look for the title of this podcast in the list of available CE courses. None of the speakers have anything to disclose. Catch new episodes of Clinical Capsules every second and fourth Tuesday, bringing concise, actionable insights from TRC experts straight to your ears. Let's take a closer look.
Let's comb through a common topic that has gotten some recent buzz, specifically treatments for male pattern baldness. And we're talking about this topic today because of warnings about topical finasteride will have patients scratching their heads on what is actually safe and effective to treat male pattern baldness. And to help us start thinking about this, let's kick things off with a patient case. A middle-aged male comes up to your pharmacy counter. He tells you that he's noticed more hairs seem to be shedding to his hands when he washes his hair. His wife also told him that the hair on top of his head seems to be getting thinner. He feels it's male pattern hair loss and wants to treat it now. He saw topical minoxidil on your shelves, but wants to know if that's the most effective product to help regrow his hair. What should the patient know about the available products out there for male pattern baldness? Now, let's look at some quick facts about male pattern baldness. It's also referred to as androgenetic alopecia and affects an estimated 50 million men in the United States. Androgenetic alopecia can start early in teenage years, and the risk increases with age. More than 50% of men over age 50 have some degree of male pattern hair loss. It's called pattern baldness because hair loss occurs in a slow but predictable, common pattern. The hair loss can start anywhere on that pattern, from the forehead to the crown, top of the area, and in between. And male pattern hair loss is usually permanent if left untreated. But this is different from other types of hair loss, like telogen effluvium. Those tend to be more sudden and hair shedding from a trigger, like stress or illness or hormones. But the hair thinning or loss from these are usually temporary and can affect hair anywhere on the body. Okay, so let's go ahead and do a rumor versus truth. And I'm glad we're getting to this because this claim has been around a long time. So let's settle it here and now. The claim is male pattern baldness skips a generation and is mainly inherited from the maternal grandfather's side. What do you think? Give you a few seconds on this one. Okay, and the answer is rumor. Modern genetic research shows that male pattern hair loss genes can come from the mother's side and the father's side. So genetic predisposition comes from maternal grandfather, paternal grandfather, uncles, even aunts or relatives who never lost much hair. It's not really an on-off switch, but a complex genetic situation. Let's dive deeper into the mechanism behind male pattern baldness. It's actually quite simple. I'm going to give you a better understanding of what treatments actually aim to do. So as you can see, the hormone testosterone is converted to the more potent form called dihydrotestosterone, or DHT, by an enzyme called 5-alpha reductase. The dihydrotestosterone then binds to genetically DHT-sensitive receptors on follicles on the scalp, and over time causes the follicles to shrink, which also causes loss of blood flow and nutrients. So in response, the follicle produces thinner and weaker hair. Over time, The follicle becomes so small, it stops producing visible hair. Quite a lot of different treatments for male pattern baldness out there, from things like medications to laser devices to microneedles. But when it comes to terms of safety and efficacy, how do we keep them all straight? Let's start by diving into the two FDA approved medications for male pattern baldness: oral finasteride and topical minoxidil. So, topical minoxidil is a vasodilator, which means it widens blood vessels. So, for hair follicles, it improves blood circulation and delivers more oxygen and nutrients to support hair growth. For men, the 5% strength is used in either topical solution or a foam. No, heads up, the liquid solution can sometimes leave the hair looking a bit greasy. That's an issue. You can recommend a non-propylene glycol formulation like the foam. It tends to be less irritating and doesn't leave that oily texture. Ensure patients know that minoxidil is applied twice a day to the scalp and not the hair. It works on hair follicles and needs to be applied directly to them to work effectively. And for the generic products, they can cost about $20 per month. When it comes to side effects, one of the most common things people report is scalp irritation and redness, itching, and dryness. Also, some fine hair growth may occur on the cheeks or along the forehead. In more rare cases, side effects like lower extremity swelling, even heart rate bumps may happen, but risk is lowered if the product is applied correctly. And we'll talk all about that in just one second. And something to warn the patients is about shedding, which can occur during the first 2 to 6 weeks of treatment. Now, this could sound scary because they're trying to treat shedding. So now they're going to have even more shedding. Well, in this case, with treatment, the shedding could be considered a good sign. It means the hair cycle is reactivating and older, weaker hairs are shedding to make room for new growth. Also, something that's easy to overlook, but minoxidil is actually flammable, the solution and the foam. So patients should avoid open flames or smoking until it's completely dry. Now, I know what you're going to ask. What about blow drying? Blow drying after application is fine, but only on the lowest setting and after the product has dried. Pointed directions on the package to ensure patients understand how to apply minoxidil, whether it's solution or it's foam. So they'll start by creating a part in the thinning hair of the scalp. The hair should be dry or just slightly damp, as wet hair can affect absorption. The patient should fill the dropper provided with the medication, usually about 1 milliliter of solution, or a half cap full of foam using the supplied cap. Apply the medication directly to the part that was created in the hair and rub it gently into the affected area of the scalp. This helps to ensure medications actually reach the skin and not just the hair. Some people are asking about using gloves when applying minoxidil. It's not documented as necessary, since systemic absorption across the skin in the hands is extremely low. But let's talk about where it could be an issue. If any of the minoxidil product starts to run down the head, wipe it off right away. Thinner skinned areas like neck or cheeks can bump systemic absorption and increase the risk of side effects from minoxidil. Then the patient's going to wash hands thoroughly with soap and water and let the product dry before laying down. So it's transferred to clothes, furniture, other humans, things like that. Our next FDA approved med is finasteride. How does it work? Well, it lowers that dihydrotestosterone concentration in the blood and thus the scalp by inhibiting that 5-alpha reductase enzyme. Oral finasteride is usually taken at 1 milligram once daily. It's also relatively inexpensive, typically around $20 a month. So anytime finasteride is dispensed, there needs to be a do not handle pregnant auxiliary label attached to the bottle, since pregnant individuals should avoid touching crushed or broken tablets, since it can affect fetal development if it's absorbed. So there are some concerns associated with oral finasteride, so patients are prepared for them. The ones most people have heard about are erectile dysfunction or decreased libido. These don't occur in everyone, but they're important to discuss ahead of time so patients know what to watch for. We also want patients to report any mood changes, including depression, irritability, or anxiety. These are less common, but we don't want to overlook them. Another key point that patients should be aware is that some side effects can persist even after stopping the medication. Finally, you may hear patients ask whether taking finasteride less frequently, like 1 milligram 3 times a week, reduces the risk of sexual side effects. At this point, there's no solid evidence that alternative dosing schedules lowers that risk. If patients ask about combining topical minoxidil along with oral finasteride, they can be told that the combo may be more effective than either one alone. Let's brush up on other treatments, which are topical finasteride, oral minoxidil, and ketoconazole shampoo. Now, compounded topical finasteride may be seen marketed as having a lower risk of side effects compared with the oral version. This stems from having a less systemic absorption from a topical. And while that sounds reassuring, FDA alerted that patients have still reported side effects with the topical version, which include erectile dysfunction and mood changes. So it's not completely risk free. And their point is we don't have strong definitive evidence showing that topical finasteride is as effective as oral finasteride. And since many patients go looking for compounded or online versions of topical finasteride, it's going to let them know to stick with accredited digital pharmacies like those from NABP. That helps ensure the product is actually what it claims to be, correctly dosed, safely prepared, and not low quality formulations that could be floating around online. And patients should know that compounded products, topical ones, usually have a shorter expiration date, around 3 to 6 months. So overall, topical finasteride can be an option, but patients should know the facts, limitations, and the realities of the evidence we have so far. Another recent option for male pattern baldness is oral minoxidil, usually gone to when patients have an inadequate response to the standard treatments mentioned earlier. So a low dose oral minoxidil could be considered as an off-label option. But it's really important to warn patients about potential side effects, since that minoxidil is actually taking systemically. The ones we watch more closely are swelling, chest pain, and rapid heart rate. So if patients want to try it, recommend starting with a low dose. A common approach is 1.25 milligrams daily, and then if needed, gradually increase by 1.25 milligram every 3 months with a typical maximum dose of 5 milligrams per day. Now, daily doses can also be split if patients feel side effects are more noticeable with a single dose, since dividing it may make the medication easier to tolerate. And one counseling point that often surprises people with oral minoxidil is since we're systemic use, hair growth can occur anywhere on the body, not just the scalp. So patients should be prepared for the possibility of increased facial or body hair as the treatment takes effect. Next up is Ketoconazole Shampoo, which is sometimes used as an adjunct treatment for hair loss. Ketoconazole topically inhibits 5-alpha reductase. And as I told you about, that converts testosterone to dihydrotestosterone. It decreases scalp inflammation, which has been known to damage hair follicles by controlling a certain yeast, a common cause of dandruff and dermatitis, but evidence is mixed on its efficacy. But if patients want to try it, ensure they know how to use it. Patients should apply the 2% shampoo, lather it into the scalp, and leave it in for about 3 to 5 minutes before rinsing off. And this could be repeated 2 to 3 times per week. There's an OTC version, Ketoconazole 1%, but it's unsure if the 1% works as well as the prescription 2%. One thing that patients should know is that ketoconazole shampoo may dry out the hair, especially with frequent use. Where ketoconazole could be a potential dual purpose is in patients with male pattern baldness who also struggle with dandruff. Let's dive into another area, which are natural supplements. People may reach for these to avoid side effects from other treatments, but let's ensure they're getting the correct information. So the two top or part of the top natural supplements used for male pattern hair loss are saw palmetto and rosemary oil. I was researching this, and a lot of these get attention online, but the evidence behind them is still pretty limited. Now, patients do want to try it. Like everything else, should they know the facts? So saw palmetto, there was a small study where 100 milligrams daily for 16 weeks helped reduce hair shedding and increased hair counts, but it didn't improve hair thickness. And even though people think of it as natural, side effects are actually pretty similar to finasteride. Something to keep in mind. Next up is rosemary oil. In one study, applying 1 ml to the scalp twice daily for 6 months worked as well as about 2% minoxidil. It's interesting. But again, data are limited and not enough to say it works reliably. And rosemary oil can cause some side effects like photosensitivity, itching, and redness, especially for people with sensitive skin. So overall, these options aren't totally off the table, but they're not as well supported as FDA-approved treatments. It's important to set realistic expectations if patients want to try them. Okay, time for another round of rumor versus truth. Second claim is hair growth from most male pattern baldness treatments is usually permanent. What do you think? And that is another rumor. Here's why. Hair growth you get from treatments like finasteride or minoxidil are temporary. Without the treatment, the benefits fade, usually within 3 to 6 months, and the hair tends to go back to baseline. These treatments help maintain hair while you're using them, but don't create permanent change. The only option that's considered permanent is a hair transplant, where the follicles are taken from a healthy area on the scalp to the thinning areas. And if patients do want to try med for hair loss, they should keep some caveats in mind. For example, meds work best if started at the first signs of balding. Off-label treatments are only modestly effective and responses vary. Plus, it takes about 3 months of regular use to see some benefit, and 1 year for full effects. On top of that, as I said, hair will return to baseline if patients stop using treatments. So patients need to be patient and persistent if they want to continue to see any benefits. When you're working with patients who use male pattern hair loss treatments, there are a few important points to keep in mind. First, add these therapies to the patient's profile. That way you can screen for potential issues, especially cases where they might be intentionally doubling up. For example, some patients end up using both topical and oral finasteride at the same time. That combination has been shown to be more effective, and they may increase their side effects. So it's important to catch that early. Next, be mindful of payer and pharmacy policies when it comes to billing. Medications used for cosmetic purposes usually aren't covered, and patients typically can't use their health or flex saving accounts for them. So check these details ahead of time to prevent surprises at the point of sale. Finally, talk with patients about safe storage. These products should be kept up and away from children and pets. This is especially important with minoxidil because even a small amount can be highly toxic to dogs and cats. Let's get back to that case. To recap, it was a middle-aged male asking about all the different treatments for hair thinning and wants to know which one is the best. Let's go through those comments and see what y'all said. Okay, so I am seeing... Okay, so people recommend a topical minoxidil, yeah. Oral finasteride, 1 a day, 1 milligram a day. Yep, I see that too. Yeah, it looks like most people got it. There's the 2 FDA-approved treatments for male pattern baldness, so good job there. There were quite a few treatments that I couldn't get to today, like laser therapy. And I saw your comments come through asking about, what about hair loss treatment for women? To get answers, I can direct you to our chart, Treatment and Prevention of Hair Loss, for more information.
Thanks for listening. We hope today's episode gave you practical insights you can use right away. Now that you've listened, pharmacists and pharmacy technicians can receive CE credit. Just log into your pharmacist letter or pharmacy technician's letter account and look for the title of this podcast in the list of available CE courses. We've linked the resources we mentioned and more on today's topic right in the show notes. Those links will take you straight to our websites where you'll find even more concise, evidence-based charts, articles, and tools. If you're not yet a subscriber, now's the time. Sign up today to stay ahead with trusted, unbiased insights, and continuing education. Listeners save 10% on a new or upgraded subscription. Just use code CC1026 at checkout. Have a question or a topic suggestion? Reach out using the Send Us a Text link in the show notes or email contact@trchealthcare.com. Your perspective matters. Share your thoughts anytime to help shape future episodes. Thanks for listening. Stay sharp, stay current, and join us next time on Clinical Capsules.